After much reluctance, the World Health Organization finally declares the coronavirus a pandemic. What does this mean for the world, and how do the governments respond to the virus that has already killed over 4,000 people, too, on the African continent? Good evening and welcome to African Perspective. I'm Aldrin Simpier. Dr. Regina Ossi will be joining me from the Orme Institute to answer all of your questions. You can send them via Twitter under the hashtag African Perspective. The World Health Organization has declared the coronavirus outbreak a pandemic. However, the United Nations Health Agency says this will not change its response to the outbreak. The term pandemic relates to a geographic spread and is used to describe a disease that affects a whole country or the entire world. More than 121,500 people have been infected by the coronavirus across the world, and 4,383 have died. South Africa has 13 cases of the virus. The WHO Director General Tedros was speaking in Geneva in Switzerland.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death.
Meanwhile, 6 more coronavirus cases have been confirmed in South Africa. This brings the total to 13. A patient in Gauteng is said to be in a critical condition. An Airbus 340-600 is en route to China to evacuate over 120 South Africans from Wuhan, where the virus began. They are due back in the country on Friday.
All of South Africa's 13 current cases are not linked to China, while the latest patients have travel history to multiple countries in Europe. While the 6 new cases relate to the patients traveling to Italy, Germany, Austria, Portugal, Switzerland and Turkey. While South Africa is preparing to welcome over 100 of its citizens from the epicenter of the virus in Wuhan, who are confirmed to be healthy but will be quarantined for 21 days. While some citizens outside the evacuation zone and the rest of China say the situation is slightly improving.
Limiting movement alone just made sure that people, were more aware of being cautious and quarantining themselves if they were sick, and it sort of made the process a little bit easier to follow.
I think now it's not as scary as when it first began. Today, there's been 8 confirmed cases of people that are infected in our city, and so we're told not to go to the city center and just stay around campus, because that's where, there's nobody who's infected or any cases reported.
While experts say each country's responses to the outbreak were different, guided by their risk profile.
In terms of the responses in other countries, it's been very varied. I think one of the difficulties was the major unknown. We didn't know how easily transmissible the virus was, what the incubation period was, if people who were just mildly symptomatic could still transmit virus before they became severely ill, or people who were still incubating could transmit the virus. So different countries had different responses in terms of protective measures.
While South Africa continues to be on high alert over the rising number of positive cases, Criselda Lewis, SABC News in Johannesburg.
The East African Community Secretariat has suspended indefinitely all international conferences and meetings in its headquarters in Tanzania with the delegates from countries at high risk of COVID-19. Secretary General of the Secretariat, in a memo told staff these are amongst the measures that are being taken at the EAC as to prevent the importation of the virus to the region, which has no confirmed cases as yet. In Kenya, the Sports Ministry suspended foreign travel by all sports teams to guard against the coronavirus.
Also suspended is all travel or transit of East African Community Secretariat staff to countries at high risk of COVID-19, according to the statement dated Wednesday this week. The Arusha-based Secretariat also announced that it will adhere to decisions of partner states in regards to travel advisories or the convening of meetings. Kenya and Uganda have banned all international conferences until further notice, while Rwanda has put in place stringent measures, including cancelling events that would attract crowds as a precaution. Rwanda remains silent on whether the 26th Commonwealth Heads of Government meeting, CHOGM, due in June this year will go on as planned. More than 4,000 people have died and over 110,000 have been infected by coronavirus worldwide, forcing countries to ban travel and forbid public gatherings. Sarah Kimani, SABC News, Kenya.
We are now joined in studio by Dr. Regina Ossi, who is a senior technical expert on TB and HIV at the Aurum Institute. Good evening and welcome to African Perspective.
Good evening. Thanks for having me.
Let's first start off here. The declaration now by the WHO that the coronavirus is a pandemic. What does this mean?
Well, it just elevates the level of alertness, and it means that actually the virus is not now found in most countries in the world. Whereas before it was localized to certain areas, a pandemic usually describes the fact that you find the virus in all parts of the world right now.
And what does this mean for governments and the different public health institutions? What is it that they should be doing?
Well, I think it allows them now to start stepping up the response, to know that this is now at a level of, we are at a level of the highest level of alert in terms of epidemics, and that they should start looking at measures to make sure that the pandemic doesn't spread further.
Why is it that this virus seems to be spreading much faster than what we've seen with, for instance, the SARS virus?
Well, I mean, a lot of things about this virus, which is the SARS-CoV-2, it's actually a relative to the SARS virus, are still unknown. And so we don't really have all the details on why it's spreading so fast. It does spread quite quickly compared to other viruses that we've had that was similar. But it is also seems to be much more contagious and also seems to have a lot of community spread. Some of the other viruses were more limited in terms of affecting people that did not have direct contact with people who were infected, whereas now with this particular virus, we're seeing cases that cannot recall any sort of exposure, especially in the United States and in Italy, where people are being affected who do not remember or do not know of anybody that was in China or had the disease that they met somewhere. And so that's really worrisome in terms of the disease.
And the severity of it compared to SARS, again, because in 2002, 2003, the SARS virus killed about 774 people. And now we see with this particular one, with COVID-19, we have over 4,000 people that have been killed over just the past 4 months.
Well, it's definitely a much more severe epidemic than the SARS epidemic was. And also, in terms of mortality, the Middle Eastern respiratory syndrome actually killed more people than this one does, but it was also very limited in terms of its spread, and so we didn't see as many people. This one, in terms of the mortality, if you're older than 70, 80, your mortality rate can be as high as 20%. And younger people are less at risk of dying. But it is relatively high, and of course we don't really know exactly how high it's going to be because it's still an evolving story, but it's looking to be about between 0.5% and 3.5%, whereas your sort of regular seasonal flu has a mortality of about 0.1%.
And what is that about the immune system that makes older people more susceptible to the virus? Because I see that the stats indicating that, for instance, in China, which has been hardest hit, that only 2.4% of the reported cases were children, and only 0.2% of the reported cases were children who got critically ill. This is now according to the World Health Organization, and China has reported no case of young children dying from the disease, from the COVID-19.
Yes, so I think all the people are always more vulnerable. There are also people who have cardiovascular disease, diabetes, and who have other comorbidities. And this is very important actually in South Africa because we have a big epidemic of TB and HIV, as you well know. And we're very worried that those people might be at further risk if they contract the COVID-19 disease. And so in other countries, really, the way that people end up dying of this illness is related to lung capacity and is related to lung illness. So they get what we call an acute respiratory distress syndrome, which is something that requires quite a lot of intensive care to be able to survive. And it's basically your lungs being attacked by the virus.
Is that why the ventilators are so important?
Exactly. So most of people are going to need some level of intensive or high care or high flow oxygen to be able to overcome the injury to their lungs. And obviously older people are a bit more frail, so they tend to have less reserves in terms of how they can weather an illness like that, whereas young people have more reserve.
Sure. And someone who is, for instance, on ARVs, how does that impact them?
Well, hopefully, we haven't seen a lot of that, so we really don't have any empiric evidence around how it will work with HIV. But with ARTs, I mean, the whole point is if your immune system is built up and your viral load is suppressed, then you actually have your best chances in terms of the coronavirus. So if you're not taking your ARVs, now is the time to probably take them. With TB is also a lung disease, so that's going to be a little bit problematic because it also affects the lungs. And so if you have active TB right now, it would be good to get on treatment, continue taking your treatment or presenting for care, because having those two together probably is not going to be a good thing, although we don't know that, we're just speculating.
What's the immediate thing that a TB patient, for instance, can do right now? I'm speaking of probably somebody who is in the DRC and who's very far from a public hospital or any health facility for that matter.
Well, generally, if they know that they have TB, they've presented somewhere and been diagnosed, and so they've been given treatment. So what we would recommend is to continue taking their treatment. TB patients, just like HIV patients, just like everyone else, needs to have regular precautions, which is washing of hands, keeping away from crowded gatherings, making sure that they're sort of protecting themselves and not trying to go where they know there have been cases in case it spreads further. And definitely following all the recommendations from the healthcare providers.
There's another point that has been raised in, I think it's one website that looks at the number of people that are susceptible or more vulnerable. And one of the cases that's being raised is people who are smokers.
Well, I think that's linked also to the lung issue. So generally anything that will weaken your lung reserve is something that's going to probably put you at higher risk of severe infection with or a severe case of COVID. So definitely I would say smokers are probably at higher risk, although we're just learning all of these things now, and so we haven't really had time to really digest all this information. A lot of it is coming out of China. There have been a lot of presentations and journal articles that have been written around how that presented in China, but everything is really fresh off the press, and we don't know how each country is going to, how each person actually, and how each country is going to actually react. And so it's very difficult to anticipate right now what would be the effect, for example, in people with TB, HIV, or smokers.
And another case being women who are pregnant?
Well, I don't think that that was a particular group that was singled out, in at least so far as we know in China. But we'll have to go back and look at the data in terms of whether that's something that was putting people at risk. But so far as I know, I don't think that there was a big peak seen in women who were pregnant at that point. But of course, we'll find out more as time goes on.
Cancer patients?
Well, cancer patients are generally at risk. Cancer patients have very poor immune systems. Many times it's because they're taking medicines that actually target the immune system. And so definitely cancer patients should really be paying attention to these developments and making sure that they are in touch with their providers and doing everything they can do in order to avoid exposure.
What is it that health practitioners can do? Those who know, for instance, that I have a TB patient, I have an HIV patient who always comes through, I have a cancer patient who always comes through.
Well, I think that the main thing is to continue with the same recommendations we've had so far, which is the patients need to be communicated with in terms of washing hands and keeping away from other people who may be sick, alerting them to potential symptoms that may require them to consult and why they should come for consultations. Most of the time we prefer for people with mild symptoms not to present in the healthcare system because we obviously don't want it to propagate from there. But when they have difficulty breathing, for example, and they start having issues with lungs, then definitely they should be going to their healthcare centers and trying to get a test for the virus to make sure that they're not infected. Obviously, there are other things that cause the same type of symptoms. There are quite a lot of other things. So it can be sometimes difficult to figure out what's going on.
Okay, especially now that we're heading into the cold season, but we'll touch on that in the next moment or so. But earlier on, we asked you to send through some of your questions that you have in relation to the COVID-19 virus. And you can still send through those questions using the hashtag African Perspective. Let's take a look at some of the questions that have come through on Twitter. Okay, so this is a tweet from Pindi, quite a number of questions that she has there. So we're going to go through each of those questions. Please ask Dr. Osai, is self-isolation an effective way of curbing the spread of COVID-19?
Well, it is actually, and it is actually the only thing that we have currently that can help because we don't have any medications, we don't have any vaccines. And therefore, people who are ill or feel like they may have been exposed should really avoid going to gatherings and going to larger places to make sure that they don't infect other people.
Okay, let's look at the other questions that she had as well. Let's not remove the tweets and let's just keep that tweet there as well. The second question is, should patients who have been diagnosed with COVID-19 be discharged from hospital prior to being retested?
Well, that's a complicated one because of the type of test we do to find out about COVID is a molecular test, which means that you detect matter from the DNA matter or RNA matter from the virus in the people that have it. And the problem with that is that it can be positive even when people are no longer sick. We know that viral shedding, which is
What does it mean? What does it mean?
Well, it means that the test can be positive, but the person is not really transmitting.
Okay.
Yeah, exactly. So the ideal test would be a serology, which we don't have right now, to be able to determine if people are completely no longer shedding the virus or no longer at risking other people basically in the community. And so right now, I think that what people are doing is just waiting for a long time to make sure they're no longer shedding the virus and the secretions, and making sure that once they go out, they can, if they have a situation where they can be completely isolated or self-isolated, then that's safe. One of the things that we have to balance is the fact that we don't have enough beds for everybody to be in hospital. And there are other people in hospital who also could get exposed to this person. So maybe it's better for them to be, if they're no longer sick, it's better for them to be home in a closed environment where nobody comes in, as opposed to being in a hospital where there are hundreds of other vulnerable patients that could also get the disease.
And is a relapse possible?
Well, I don't think so. I think most of these, except if there's a slight variation of the virus, most of the time these are one-time infections and then the viruses change slightly and then you become resusceptible to them. I don't think that we've seen any case of people relapsing in terms of the disease right now.
Okay. And the last question is, does the asymptomatic confirmed cases pose any of the transmission?
Yeah, so in terms of that, it's a little bit complicated. I mean, the fact of the matter is that there are very few people who completely don't have symptoms, but there are people who are just about to have symptoms. So they're like 24, 48 hours before the onset of disease. And yes, at that point, they do pose a risk of transmission. So you could potentially be with somebody who doesn't have any symptoms, but who's about to get symptoms, and they already have the virus that's they're shedding from their nasal passages or from their cough. And that's a big problem in terms of transmission because people are not necessarily aware that they're sick, but usually it's incipient infection, meaning it's just about to start. It's not people who are just for weeks on end asymptomatic.
Is it possible for somebody to actually have the virus, but the virus is not detectable, but possible that they can transmit the virus?
Usually not. That would be a very rare case scenario, because the whole point of it is we look for the virus in the droplets and the sneezing and the nose passages, which are the places where if you were to transmit the virus, you would have to have virus in there to be able to transmit. So if that test is negative, it's very unlikely that you would be able to transmit. Of course, it can be negative and then become positive a few hours later. So there's always a temporal association where you're not necessarily sure. I mean, a negative test today doesn't mean tomorrow it's going to be negative, basically.
Sure. Okay, let's look at some other tweets that have come through. A tweet here from Mato says, any information on blacks being immune to the virus? And this has been a reoccurring question that has been coming through, specifically because there's such a low rate of new infections on the continent, and which has brought about the perception that probably black people are immune to the virus.
I don't think we can say that. I think that we are still very early on in terms of how the epidemic is going to look in Africa. I think that generally these zoonotic viruses, coronavirus, SARS, the flu, these are winter circulating viruses, and therefore there is an association with temperature. We don't have very cold temperatures right now in most of Africa. In South Africa, we are going into the winter season, so we'll see what happens there. On top of that, I think in the US, we're going to start seeing some infections as well in African Americans. I haven't really looked at the data in detail, whether people have been reporting that, but I think it's more of a constellation of things that are happening right now. Very poor, very little exposure to the virus currently in Africa. Maybe the temperature is too high. Currently, we were not yet in winter. Could be many things, but it's also a possibility. I mean, we're only going to find these things out after the fact, really.
From the information that you currently have, and from the 2 deaths that have currently been reported, which is one in Morocco as well as one in Egypt, do we know whether these are black Africans?
I don't really know for sure. I know that the first cases in both those countries were not locals from the countries. They were people who came in or had traveled to Italy. But I think the one in Egypt was somebody who was Italian.
Sure.
And so there are lots of people who are, and I don't know if these are the ones who died as well, right? So I think we don't know exactly who they were. I think there's need to also protect people's identity, and also I think they're not really reporting everything that they need to, don't have to report on people's color in terms of how they are, or race in terms of how they are reporting their deaths, but it's not clear.
But what does that underreporting mean for us in terms of trying to understand how the virus actually works, and what type of bodies it would identify as a perfect host, for instance?
Well, I think that we know, right? We should stick to what we know. We know that elderly people are at very high risk. We know that people with cardiovascular disease, high blood pressure, diabetes are at very high risk. And we know that children seem to get the disease, but probably have a milder case, or tend not to be diagnosed, or not to be hospitalized. So I think those are the things that we know, and we can stick to those, and we'll find out some of the other things a little bit later. I think there's just not been enough exposure in people in Africa for us to say that we're immune. And in order to be able to say that from a scientific standpoint, we really have to do some testing to make sure that we understand what that immunity really means. If it is immunity, what is it, and why is it occurring, right? So I would say that that's a message that I would be very worried if that's what comes across, because we need to not panic, but we need to take this very, very seriously. And we need to make sure that we protect ourselves, even though there may be some understanding or some sort of urban legend out there that we are immune. We don't know this until we've actually been exposed to the disease and survived it. So I would caution against having that message be the one that's remembered from this conversation.
Sure. There's also, from the press briefing that was held earlier on by the World Health Organization, where they spoke about what was very important was that containment. Containment is very important instead of mitigation. That's what the message was from the World Health Organization. And this, of course, some people you would know, those who are panicking, are saying that close the borders, don't allow travel, don't allow people who are coming from other countries to come into the country. And what would you say with regards to mitigation? Would it being more severe determined by other people, looking into, like the World Health Organization, saying that mitigation probably going a bit too far, rather focus on containment?
Well, I think it's a function of the epidemic, and I think we have very good resources in Africa. For example, the NICD has done a really good job of putting up a great website that explains a lot of things. It depends on where we are. So if you try to contain an epidemic, you have to get to the point where that's actually effective. But once you are no longer able to contain it, then you have to start mitigating. So that's usually, it's sort of a two-step process, right? So in South Africa currently, we're still at the level of containment because we're tracking, contact tracing every single person who was in contact with the people who are sick right now and making sure that they're self-isolated, that they don't go into settings where they're going to be able to infect other people. And we're watching very closely what happens to the community transmission. Because once you start having community transmission, you have to start thinking about changing your case definition and making sure that more people get tested, and you start alerting the public to saying, well, you don't have to have known this person or these people went to Italy. You could have just been in a taxi rank and gotten COVID-19, which is not the case currently. So I think it's all about letting the experts determine what we're trying to do and what we should be doing. And we have a very good team of experts at the NICD who are in charge of this. And they'll do a good job of probably communicating with the Ministry of Health and making sure that we are all on the same page in terms of what we need to do.
Looking at the current system that we have in place and the current plans that we have in place, including contact tracing, would you say that our plan, you'll give it an A, considering that now at least we have 13 cases that have been confirmed, and from the previous press briefing that the Minister of Health had, I was actually quite impressed that you had the one person, for instance, who has been infected, but next to that person, you are able to identify how many other people that person may have come in contact with.
Yes, I think that definitely the NICD and the Department of Health are doing a great job. Of course, it's much easier to do a great job when there are not that many people. But for each person, they probably have to call hundreds of people to find out and figure out whether they were in contact with this person. Some people were in planes. And so I think that we underestimate how much work it is to actually track and trace all of these people who were in contact with these 11 or 13 people now. And therefore, at some point, it becomes a human resources problem. So you're not going to be able to catch up with finding all of these people and making sure that they are tested or confined or whatever it is that your measure is going to be. So that's where you start getting into the issue of mitigation, because you're not going to be able to contact trace 50 million people in the country.
Should we look into a plan, for instance, as a plan B this is now for our country, at what Italy is doing at the moment, and calling on NGOs as well to form part of the track and trace teams?
Well, I'm sure they have a plan, and I think that there is a plan A, a plan B. We're just waiting to see what the evolution of the epidemic is going to be, because if it remains contained to these people who are unfortunately sick right now and they get better, then we really don't need to panic. However, we need to then always be vigilant in terms of what's going on at the borders and who's coming in and who's not coming in and how we're going to handle that. I do think that the epidemic or the epidemic response unit has actually put in place quite a lot of plans and different sequential plans depending on what is happening with the epidemic, to make sure that we're going to be on top of it regardless of what happens. Of course, everybody has to play their part. We don't want people panicking. It's very complicated if everybody goes left, right, and center. If they say, don't travel, and people feel like, I'm not at risk, therefore I will travel. It gets very complicated to manage it. As you can see in Italy, it's been very complicated to manage it compared to China, which is more, I would say the regime is probably more autocratic, and therefore it's easier to get some of these measures in place because they're very restrictive. They're very restrictive measures to the freedom of movement of people and the freedom of association, actually.
Sure. And let's look at this tweet as well that we received earlier on. And remember that you can send us your questions as well as your comments to #FullView. The professor you interviewed on official SABC yesterday said something incorrect. He said that more people will die from flu than the coronavirus. How does he know that the coronavirus is just, how does he know that if the coronavirus has just started? Okay, so I guess this is the comparison between a normal influenza compared to coronavirus.
Well, I think it depends on whether you're talking about a proportion or absolute number. So in terms of absolute number, the flu does kill quite a lot of people every year, but it also infects millions every year. And the mortality rate is very low, it's 0.1%. But because it affects almost everybody in the planet.
It's 0.1%?
0.1%, yeah. So that's the general mortality rate. But because it infects so many people on the planet, you do have quite a lot of people dying of flu every year. However, most people recover, and most people have a mild case of it, and most people don't die. You know, 99.9% of people don't die. Whereas what is happening now, and this person who sent this tweet is partially right, is that we don't know how many people are going to be infected by the coronavirus. If it's the same number as the people infected by the flu every year, then we'll be in serious trouble because we'll probably have 5 to 10 times more deaths.
Right now, isn't it standing at around about 3%?
The death rate is 3%, so that's about, you know, if you say 0.1 is about 3 times or 10 times the death rate of the flu.
Sure.
But currently the number of people infected is lower than the flu, right? So in the end, this year so far, yes, the flu probably has killed more people than coronavirus. But we don't know how far. What the WHO and everybody wants to do is to not get to the point where we have as many flu cases or as many coronavirus cases as we have flu cases in a year. Because that would really be problematic, because we'll have 3% of those people will die.
Okay, let's go to a quick ad break. When we come back, we'll be taking more of your comments as well as your questions. You can tweet them under the hashtag African Perspective. So everything and anything that you'd like to know, and as the doctor has been indicating, that this is of course a new virus, and as much information that has been made available, we will be able to share that with you. But there are also some questions that remain glaring, and we need to find out all those answers as the time goes on. Let's go to a quick ad break. When we come back, the conversation continues. The ANC Youth League in Limpopo is concerned about government's decision to quarantine South Africans coming from China in Limpopo. Over 100 citizens are to be evacuated from China, and they are expected back in the country on Friday. A hotel outside Bulugwane is said to be making the final arrangements ahead of their arrival.
We're uploading them for bringing them to South Africa is their home. But we are appealing to the president and the minister to review their decision of taking all of them to Limpopo Hotel. We are saying that all those people must be distributed according to their provinces, because our feeling is that in the country of South Africa, we're having 9 provinces, whereby we're having 9 departments of health in all provinces. So can they go there, and also hotels in all the provinces and vacant land?
Well, we have to say as well that the president last night, speaking from OR Tambo, did say that the location won't be made public. So the location that the ANC Youth League is speaking about in Limpopo, that has not been confirmed. And Doctor, I guess that's the other issue that we need to deal with. And these are the anxieties of people in various communities scared to get in contact with anyone who has this virus, and also the discrimination that might just come.
Yes, that's actually been a real problem. Even in the beginning of the epidemic in China, a lot of people have been shunning anyone who looks Chinese. I mean, people are always worried, or, you know, if somebody coughs, so you're bringing coronavirus here. I think it's, you know, we're getting to the point where we have to just be reasonable, and we have to decide that, you know, we need to do what we need to do for ourselves, and we don't need to also panic about other people. I think that it's very important for the people who are coming back from Wuhan to be able to be somewhere, and if possible, from an epidemic standpoint, not be spread across the country, like was suggested, because that obviously creates many different things that you have to follow up. Now, of course, people always want them to be somewhere else and not where they are. And I think it's some of the things that have happened in this epidemic have been quite shocking in terms of, you know, ships not being able to dock to release passengers, and then passengers getting sick and then dying. I think that those are things that we're going to ask ourselves some ethical questions about afterwards. I think it's a time for solidarity. It's a time for us all understanding that this is coming, and that we have to do the best that we can to be able to protect ourselves and protect our futures. And I think, you know, everybody's doing their best. Nobody's trying to say we're going to throw coronavirus at, you know, a particular set of people or not. And I think we have to not be accusatory or judgmental in terms of how people got it and who did what. there's a saying in my country, say, when you find a snake in your house, you know, you don't start thinking about where did it come from and what window was open. You try to first get it out of your house and make sure it doesn't bite you. So I think that's sort of where we are.
Yeah. Speaking about that, the role that will be played now by the crew that has now gone to Wuhan to try and bring back these 121 students from Wuhan, what exactly is it that they will be doing once they land in Wuhan? What steps and procedures is it that they must be following?
Well, that's going to be difficult to answer. I mean, I'm not really part of that crew, so I'm not really sure what they'll be doing. But I definitely think that they will be testing these students to make sure that they're not sick and that they're not shedding the virus currently. And therefore, they're probably going to be relatively safe to bring back. Also, Wuhan is seeing a decrease in the epidemic. So actually there it's over, and there are some people who are thinking, why bring them back? Why don't they just stay there? Because actually South Africa is starting the epidemic, and there they've already weathered one. But of course they want to be home, and we don't know when the restrictions of travel and movement are going to be lifted in Wuhan. So I think that I understand that they want to come home. But I think definitely they will be tested and made sure that they are not shedding the virus, and therefore that the people who are taking them back are not going to be at risk.
They then land in South Africa, for instance. They get taken to this place where they are being quarantined. What happens in that particular space? When we speak about a building or a space that has been quarantined, what is it that happens?
Well, generally, it's restricted movement, right? So some people have done it differently. Some people have allowed people to gather in public spaces. Some people have allowed limited contact with others, for example, caterers or people delivering food. It just depends on what the plans are. And I think it also depends on what the risk assessment is for these people. If we feel like they're very strongly that they're not at risk, they will just be kept aside from other South Africans and other people for 14 days to make sure that that's the case. A lot of other countries have successfully done that. There were patients from Wuhan that were repatriated to France, to the US, to other places where they kept them in particular areas. I don't know if there were camps or different hotels or places for 14 days, and it didn't seem to be overly traumatic for those people. So I think it just depends on, the government will have to make a risk assessment and see what they want to do.
Okay, let's quickly put up a tweet that we got earlier on as well, which is under the hashtag African Perspective. Here is it Skettling, who says that what will Africa be doing differently to tackle this pandemic? South Korea, China and EU measures cannot be copied and pasted. Given our 1, lack of resources in the health sector, 2, limited access to clean water, and 3, large homeless population.
Well, I mean, I think there's some truth to that. I think every country has to adapt their response to their local realities, right? We do agree that we don't have a lot of good health resources, and that's going to be problematic, which is why, I mean, the government is making a big effort right now to contain, because you don't want this to be everywhere. So really the steps that are being taken may become more and more severe if the epidemic continues to spread, but the whole point is not to get to a point where we need resources for 50 million people in South Africa, for example. So definitely there is a need to be cognizant of what your local environment is. In terms of the homeless population, I'm not really sure, you know, if that's really going to be a big factor, because it's going to be the same like for everybody else. And clean water is problematic. I mean, people need to wash their hands, people need to feel like they're safe. So definitely, but you know, having soap and dirty water sometimes is also okay, right? So I think it's about us figuring out what we can do and how we can adapt to the situation. But I think containing the epidemic is the most important thing that we can do right now.
And looking at countries, for instance, on the continent with poor health systems or poor health infrastructure, what is it that they can do in terms of isolation? And I know the WHO during the press briefing earlier on as well spoke about countries on the continent that are struggling with isolation facilities.
Well, so yeah, that's going to be really difficult. I think they can decide on, try to see if they can do some temporary isolation facilities. I mean, there were, in Wuhan, they had these field hospitals, you know, in times of cholera epidemics, people put up tents. So those are all possibilities that could happen in areas where we really don't have the infrastructure. But mainly, the idea is to really reduce the spread of the epidemic now. So keep people at their homes, keep older people in their homes, let people not gather, maybe do early what they call social measures to be able to reduce the spread of the epidemic so that you don't get to the point where you need to do that. But I think if we do get there, it's going to be really, it's going to be a very tough ride, actually, to be honest, for a lot of people on this continent.
So public gatherings, do you try and avoid public gatherings? Do you try and implement, because some countries, for instance, have decided, like as you heard earlier on, Kenya has decided to cancel some sporting events and also stop their sporting teams from traveling as well. Are these measures that countries should be looking into? And I guess it will depend on the country-to-country basis.
Yeah, so I think that once you, for most of what we've learned so far, once you get to the point where you have community transmission, you need to really seriously start putting in social distancing measures and making sure that people are not exposed. Because now we have lost track of where those infections are coming from. Currently in South Africa, we can still track them back to the source. And so we can see where people are and we can try to be proactive about isolating them. But once you've lost that, you really need to start putting in place these more restrictive measures. I think, you know, it's up, again, it's an assessment of risk and to see where people want to go, how much exchange is happening, how much people are traveling, and whether that's really necessary. And you then end up with a situation where you have to make a call. You know, is that what we need to do? I do think that it's going to happen sooner or later, that we will be restricting movement a little bit more severely than what we're doing now.
What, on the continent or in the country?
On the continent and in the country.
Why do you say that?
Well, because we currently have 13 cases, and we've had some transmission from the original cases to secondary cases who didn't travel, right? We knew about, well, there's one person who came from Portugal, but we're not sure that all of these people actually traveled. Some of them were here. So you're getting to the point where it's still sort of a primary to secondary case. It's not somebody who was randomly, you know, in a taxi rank or in a supermarket got infected. But I think that they would want to make sure that it's not going to go that way. And so I think the next couple of days are going to be crucial, watching what's happening with these people who were exposed to these people who came back, and seeing whether more cases develop and whether it's necessary to now go to the next step. So there's steps in epidemic control. So right now we're sort of at the beginning of it, where we have just cases coming in, and then there are about 4 or 5 more steps to come.
If that's the case, then how do you tell someone to calm down, don't panic?
I think it's about being reasonable and understanding that we're all at risk. I think that, you know, there are many other things that are very deadly in our country. TB, for example, kills 4,000 people a day, much more than globally. 4,000 people die a day. In South Africa, it's actually a few hundred every day. And therefore, you are in situations where people don't pay attention to those things that are also very deadly, that are also transmitted in taxi ranks and in, you know, in places of gathering. But people feel like that's not going to affect me because, you know, I live a different life. I am not poor. It's a disease of poverty. But, you know, COVID doesn't discriminate. And so that's very different. So I think we have to just use all of our means that we have to make sure that we practice generally safe measures, so washing hands and coughing into your sleeve and not coughing on people. If you're ill, not going out and going to a concert or a rock party and, you know, hanging out with everybody else because you want to have fun. You have to think about other people and say, okay, actually now this is not a good thing to do, let me stay home. And I think people are going to be staying more home. I think the main thing we shouldn't do is, you know, go to the pharmacy and buy every single bottle of sanitizer. And, you know, I heard people on the radio talking about how they're buying, you know, lots of money worth of things that they will keep in their homes. And it doesn't really help anyone because eventually, you know, if we all are on lockdown, we all should also share our resources. And we should not always try to hoard and, you know, sort of have these, you know, everybody for themselves and God for all kind of attitude.
The Easter weekend is coming up. Lots of traveling that happens on the Easter weekend, and also lots of church gatherings on the Easter weekend. And I'm now thinking about the SABC church, for instance, in Limpopo, where thousands, if not close to millions of congregants gather in Moria City. For someone who's watching, what would you advise them right now? Someone who would be going to a church gathering, what is it? What are some of the precautionary measures that they could put in place?
Well, again, I think it's, you know, always washing your hands, not touching your face, not coughing. If you're feeling ill, not going. Unfortunately, masks are not very helpful for the people who are trying to protect themselves, but they're helpful for people who are sick. So if you're sick and you can get hold of a mask, you should put one on so that you don't infect other people, but it's not very helpful to be walking around in masks, at least so far as we know. And I think that what they really need to do is the leaders of the Church of ZCC and others really should be watching what's going to happen in terms of the DOH. And if the DOH says we're cancelling gatherings, then they have to heed that warning and not do it, right? So, but we'll have to see what happens. I mean, Easter is still about, what, 3 weeks away?
Yeah.
So it's, it's a daily evolving situation,
As we see now that the number of cases also increasing, now we're standing at around 13. So the extra precautionary measures that the churches can take. Let's speak about companies. What is it that companies can do where people are employed, people meet between 9 to 5, they are working in certain places and interact as well?
Well, so I mean, I'm speaking from what we've heard other companies do. Most in the US, a lot of companies have instituted teleworking, so working from home and not actually going into the office. But these are big campuses like your Google, Facebooks, and your big California companies. I think a lot of companies, even locally, have restricted travel, work-related travel, because it's one thing to go somewhere and get coronavirus and come back, but it's another thing to be stuck somewhere because of a quarantine for 2 weeks or 3 weeks or a month, or be somewhere where you cannot come home to your family. And so a lot of companies have restricted travel, including the universities, a couple of other places. In many other countries, they are starting to do online classes for universities, like in Boston. Harvard has gone to online classes, UCLA has gone to online classes. So I think it also depends on the level of comfort for each of and then the resources available, right, for them to be able to do that. You don't want to do something like that and put a lot of children who don't have laptops at a disadvantage or don't have internet, for example, and say now we're going to be doing the lectures online. So I think we also, again, have to adapt to our local situations and see what's needed.
And those companies that have implemented at least some precautionary measures, you've seen sanitizers, where do you keep these sanitizers? I was walking in through the building this evening and someone was telling me that there's no need to use the sanitizer because you've already used your finger at the biometric scanner.
Well, so this biometric story is one that's circulating a lot. I think Wits did suspend their biometric service. But I do think that what happens is you need to, if you're exposed, you need to then sanitize your hands. But of course, if you're sanitizing your hands and then touching handles and the handles are not cleaned down, all of these things need to be cleaned down as well, right? So I think it's the companies, the cleaning services have to make sure that they clean them down. You would ideally put the sanitizer right next to the biometric machine so that when people either sanitize before and then touch on the finger.
So what you sanitize before you actually touch the...
And then after.
And after.
Yes. You have to be a little bit obsessive about it.
Sure. So does this mean that the sanitizer can kill the virus?
Yes, it would. Viruses don't survive a lot outside in ambient air for a very long time. Even the HIV virus, none of them are very, you wouldn't find them in dirt like bacteria. Bacteria can survive in dirt for a very long time.
Yeah. I was speaking to the Minister of Home Affairs, who's the former Minister of Health, Dr. Arun Motsoaledi, and he was saying that a virus would normally last about 10 to 13 minutes on a surface, and then somebody else then disputed this on Twitter, saying that, yeah, on the skin probably would last for only survive for about 10 to 13 minutes, but on a steel surface, for instance, it can go for up to 10 days, survive for up to 10 days?
I think it depends on the virus, but I think there's actually a report that was done where people swabbed surfaces in China and looked at which ones still had virus present, and it showed that the virus does stay on certain surfaces for a long time, but we'll still find out more once we get more information. But it's not really 10 days. It's usually just a matter of hours. But we know for sure that, we have to be careful with the surfaces we touch, because yes, you can pick it up from there.
Okay, and the final one would be to health practitioners themselves. And I think I saw a tweet earlier on, someone was saying that for people who work in a doctor's room, but is not necessarily a doctor, what measures should they be taking?
Well, so I think they need to make sure that they can easily recognize what are the symptoms, right? When people call to say, I have cough, I have fever, I'm having difficulty breathing, then they can maybe make sure that they're being triaged to the right place. As you know, the government has dedicated some hospitals that will be the hospitals that will receive patients with coronavirus, so people should be probably referred there. People with mild symptoms should be told not to come to the doctor's office. If they have severe symptoms, then they should seek care, because you don't want to go there and obviously in the waiting room find other people who could be infected. And definitely they should wash their hands as often as possible and make sure that they maintain a safe distance from the patients, for example, which is not always possible. Yeah.
But how do you know that this is a severe case, or you're having severe symptoms, when we, as we said earlier on, we're going into the cold season and there'll be lots of coughing, lots of people with fever as well, with high fever as well?
So we're going to have to ramp up all the testing. So what happens now in other countries where they have their cold season and flu, they test everybody for flu when they come in, and those who are flu negative get a test for COVID. So basically they look for the COVID, SARS-CoV-2 only in patients who have no other respiratory illness, so have flu negative. But it's, you know, we'll have to figure out what the algorithm should be. What is certain is that NICD has a hotline for healthcare providers and also one for the public. So I think people should use those as much as possible so that they can get the most up-to-date information. Everything I'm saying here is going to be outdated by tomorrow.
And that's the other thing. Dr. Regina Osi, thank you so much for your time.
Thank you.
And that's the other thing about the coronavirus. It is quickly developing as new information comes through. Let's quickly focus on this particular story, because the coronavirus is also having an impact on various economies. The Zimbabwean monetary authorities believe that the small Southern African nation's struggling economy will not seriously be impacted by the coronavirus that has been hitting global markets that have been tumbling for days now. This is despite Zimbabwe's economy heavily dependent on cheap imports from China and also exports ore and other raw materials to China. Zimbabwe is one of 21 African countries that are dependent on the sale of raw materials to China.
The COVID, impact of COVID on the economy minister, I think it's on my side. I want to say that it has got Zimbabwe being a small economy, but now being a small economy, there are benefits and negatives. You need to, sometimes we are insulated, Minister. Why do I say so? From two perspectives. If you look at the price of fuel, global market has gone down 30, 40 cents per barrel. Zimbabwe imports fuel of 1.5 billion per year. So it means that when the price goes down, it means we are going to have more fuel, Minister. So positive. So the COVID impact on price of fuel, Zimbabwe being a fuel importer, which needs fuel, it means that the price will go down for us, and therefore it's a positive there. So market is a positive. Gold being a safe haven product, the price has been going up, 1,600 per ounce right now, because people are moving from the stocks into the gold. It means again we are producing. If we produce more gold, again it's positive. But yes, if you look at tobacco, our major market is China. We do hope and pray that the price will remain the same. So there are positives and negatives.
And as part of the SABC's mandate to educate the nation, on Saturday, one of our current affairs shows, Health Talk, will continue to unpack this pandemic. You can watch Health Talk at 9 o'clock. That is Central African time. Our team that is working on bringing news on the coronavirus will continue to bring you updates as we wait for the South Africans who will be evacuated in China and arrive back home on Friday. Thank you so much for watching the show. It is a very goodbye from me, and remember that in case you missed the show and you'd like to share the link probably to the show, you can go on to our SABC YouTube channel and share it with your loved ones so that they are too informed. Goodbye.